Even as the COVID-19 pandemic ebbs, infection preventionists have a lot on their plates. The deadly pathogens that infection preventionists fought before COVID-19, they also had to fight during the pandemic, and will certainly have to keep on fighting them after COVID. It comes with a job. Hi, I'm Frank Diamond, the managing editor of Infection Control Today. We want to give infection preventionists the tools and knowledge that they'll need to battle pathogens that shrug off the drugs used to treat them. To do that, we talk to the experts, which brings me to my guest today, Heather Saunders. Heather is an infection preventionist, among many other things, and she has an impressive list of accomplishments, too many to list here. Google her by all means. Heather works at Johns Hopkins Hospital, where she is the director of infection control for the Office of Population Health. She's also a consultant, the owner of a company called Broad Street Prevention. She guides businesses and the healthcare industry in their infection prevention and control efforts. And we here at Infection Control Today are especially lucky because Heather is writing an article for us about the looming threat of emergent antimicrobial resistance that COVID may have encouraged, so to speak. Heather, thanks for joining us here today.
Yeah, it's a pleasure to be here.
So what have you found out so far in your research for your article?
Well, Frank, this is a really important topic. I don't think I can stress enough just how important this topic of antimicrobial resistance is. So let me start off with just a really startling statistic to really drive this point home. So currently around the globe, we see around 700,000 deaths each year to drug resistance from bacterial infections, malaria, we've got HIV/AIDS, tuberculosis. But by 2050, public health experts predict that that number is going to be estimated to be somewhere around 10 million deaths annually to drug resistance. 10 million. So that's surpassing the current number of worldwide deaths for COVID-19 pandemic, which we of course don't want to make light of the pandemic right now, of course, but really just want to drive home for infection preventionists what an important topic this is. And I think, as we think about this, we're really far removed from the discovery of penicillin, right? So none of us remember what it was like to not have antibiotics to treat infections, but we are moving into this era where not having antibiotics to treat infections that we take for granted being able to treat is going to be more of a reality. And some of our medical advances, things like joint replacements, chemotherapy, transplants, those are going to be things that are life or death situations that are not going to be possible without the antibiotics that we take for granted right now.
Yeah, it's interesting. Whenever somebody says they wish they were born and lived in a different era, I said, you mean before 1940? Because that's when penicillin came along.
Right, exactly.
Other healthcare experts that I have spoken to point out that the world-altering pathogens are viruses for the most part, such as COVID-19. And what you're talking about are bacterial and fungal problems, right?
Right, exactly. And a lot of experts are referring to the rise in antimicrobial resistance as being the silent pandemic. Because for one, we're not talking about this enough, about this issue of antimicrobial resistance. But also sometimes what we see is the transfer of these organisms from person to person without our knowledge. So individuals being able to be colonized with these organisms that are antimicrobial resistant, that are fungal infections, they're bacterial infections. And the more resistant they're becoming, the harder it is to treat those infections. And they can cause a number of different infections. They can cause pneumonia, they can cause wound infections, urinary tract infections that lead to sepsis. And then we are running out of antibiotics to treat them. So this is a huge issue that I think is really, like I said, accelerating the pace in which we're moving to this post-antibiotic era. So of course, respiratory infections, incredibly important, those viruses incredibly important as we've seen with the COVID pandemic. But I think arguably so, equally important is this issue of antimicrobial resistance and not having the antibiotics to treat some of these common infections that we're so used to being able to treat right now.
As you know, the CDC recently launched an effort to try to cut over-prescribing of antibiotics at hospitals for certain conditions. I guess, do you think that is that a good first step? I'd imagine you think that doesn't go nearly far enough, but I don't want to put words in your mouth.
Yeah, no, that's definitely a great first step. Antimicrobial resistance and antibiotic stewardship really, go hand in hand. We need those antibiotics. So being stewardly of our use of antibiotics, making sure the prescribing of our antibiotics is judicious is incredibly important. What I think doesn't get enough attention is the role that infection prevention and control plays in decreasing the rise in antimicrobial resistance or containing antimicrobial resistance. This is really a multi-layered approach, just like we saw with the COVID pandemic. And we have masks, we have social distancing, stay home when you're sick. There's lots of different layers to preventing and controlling infections. Antimicrobial resistance is definitely no different. Antibiotic stewardship is incredibly important. We haven't had a new class of antibiotics since 1981. So we've really got to look to develop new classes of antibiotics. We've got to look to be really judicious with our use of antibiotics, but we've also got to look at those other layers, the other ways in which we can prevent and control resistance. And infection prevention and control is one piece of that puzzle.
You're an infection preventionist. In fact, you're director of an infection prevention department. So speaking to your fellow infection preventionists, what can they do to help this effort along?
Yeah, there's a lot of things that we can do as infection preventionists in the fight of antimicrobial resistance. A lot of what we've seen in the COVID pandemic, unfortunately, I think has accelerated the spread of antimicrobial resistance. And there are things that we definitely can do to contain, prevent, and control resistance right now. I think number one, like you mentioned, CDC has launched a lot of different efforts, and the government in partnership has launched a lot of different efforts to contain antimicrobial resistance through the state public health departments. So IPs should be aware of what the state public health department is doing in containing antimicrobial resistance, being a partner in that, collaborating with them on their containment efforts. A lot of state public health departments are doing surveillance, increased surveillance for some of these novel and targeted antimicrobial resistance organisms and mechanisms. So I think IPs really need to be aware of what the efforts are at their state public health department and how they can collaborate with those efforts. IPs need to also have their own surveillance systems in place. They need to know what they're looking for. And they need to know what their laboratories are doing to identify these organisms. Do they have the capability to identify Candida auris or carbapenemase that sometimes are harbored by carbapenemase producing or carbapenemase resistant Enterobacteriaceae. So knowing what your laboratory is doing and having your own surveillance systems in place to identify those organisms. The 3 I's: identify, isolate, and inform. So we want to be able to identify with those surveillance systems. We want to make sure that we are isolating appropriately individuals that have antimicrobial resistance, and that we're quickly informing our public health department so that we can act upon identified resistance, and particularly some of the novel and targeted resistance that we're seeing increase in prevalence. And then I think, it's back to the basics, Frank. It's the basics of infection control really work to contain the horizontal transmission of some of these antimicrobial resistant bugs. So hand hygiene, environmental cleaning, good use of personal protective equipment, those are all really important parts of containing, preventing resistance. And we've got to get back to the basics after the COVID pandemic and all the changes we've experienced, back to the basics of focusing on infection prevention and control measures like hand hygiene and environmental cleaning. So those are just a few of the different things that IPs can do. I think also knowledge is power. So informing ourselves of those organisms, how do they spread? What are the ones that are really being targeted by public health efforts and containment? And educating our healthcare workers. I cannot tell you how many physicians I've talked to that they don't know what Candida auris is. And I think we need to be out there informing our healthcare workers about these organisms and the threat that they have to our ability to use antibiotics in the future.
How much do you see a public-private effort coming out of it? We see a little bit with the CDC, but more like on a scale of what we did with the vaccines for COVID, or will it have to be a calamity first, and then that will happen?
Yeah, no, that is a really great point, because you're right. The development of new antibiotic classes is not profitable for pharmaceutical companies. It's part of why we think that we haven't seen any new antibiotic classes of antibiotics since the 1980s. And so I think that policy is important here. Funding is important and toward trying to develop new antibiotic classes for the treatment of drug-resistant infections or infections in general. And I think developing public and private collaborations to be able to do that is one way in which we have an opportunity to, to further our fight against antimicrobial resistance. I can't speak to any specific current policy that's in the works, although I know that there are definitely people out there that are lobbying for funding and lobbying for such policies to be created so that we don't have funding and profit as a barrier to the development of new antimicrobials.
Now everybody, the public, even the public knows about wearing a mask, hand hygiene, social distancing. Now, are those the three things that IPs will have to A, do, B, monitor and keep track of among their fellow healthcare professionals? Or am I missing something? Is there a fourth or fifth step when it comes to antimicrobial resistance?
Yeah, I think you hit the nail on the head, definitely, with hand hygiene. And then I think the use of personal protective equipment, making sure that we're placing these individuals on the appropriate transmission-based precautions, that we're monitoring the adherence to those precautions and the use of PPE. Environmental cleaning is also a really big important one, and it kind of depends on the organism, which I think that is why it is so important for us to know our bugs, if you will. Candida auris, Acinetobacter, for example, those are very environmental organisms. They love the environmental reservoir, just waiting for somebody to come along that hasn't washed their hands prior to patient contact. So, I think environmental cleaning is another big important piece. And Candida auris happens to be pretty hardy and a little bit resistant to some of our common disinfectants. It's important to know that. Important to know that if you have a patient with Candida auris, that we should be using bleach or bleach-based products or something that is on that EPA list of agents effective against Candida auris. So it's going to be really important for us to know those organisms, so we know the prevention measures that work well. But the tried and true measures like hand hygiene, good use of PPE, environmental cleaning, those are definitely ones we want to focus on, be able to monitor, and educating our healthcare workers about the effectiveness of those in the prevention of infections.
What about systemic changes in hospitals, how they function, and how infection prevention functions within a hospital system? You see changes coming with that in terms of this problem?
That's a really good question. I think that this is a multidisciplinary issue. So what I would love to continue seeing is the infection prevention and control departments collaborating with other disciplines across the hospital. Leadership, making leadership aware of this issue. Environmental cleaning, making them aware of this issue. That department playing a role in the prevention and control of infections. They definitely have a part in monitoring environmental cleaning. They can take a part in fluorescent gel monitoring, ATP monitoring, if you will. They play a part in that. Physicians play a part in it. So making this a really multidisciplinary effort, and if that is not already the case in the infection prevention and control department, it should be, and would love to see that that become more of a common thing in the fight against antimicrobial resistance.
Is there something that I neglected to ask you that you think is pertinent to this subject matter that you would like to add?
Yeah, well, I'm really excited about this article. And I think, we'll definitely chock it full of tips and things like that, that IPs should be aware of. I think it's also important that IPs be aware that a lot of experts talk about how the COVID-19 pandemic might have accelerated the pace of antimicrobial resistance. This was a problem before COVID, but we're seeing that it's really a problem now. We're seeing more regional outbreaks, more regional increase in some of the novel and targeted antimicrobial resistant organisms, like some of the carbapenemase producing organisms, Candida auris, for example. CDC has a tracking website. They track some of the novel and targeted resistance. A lot of public health departments do that as well. And a lot of areas of, at least our country, the United States, is seeing some increases in antimicrobial resistant organisms. And some of us are, we have the theory, the hypothesis that the COVID-19 pandemic somewhat accelerated the pace of resistance for a couple of different reasons. One reason being that we used more antimicrobials. We did a lot more just in case prescribing during the COVID pandemic, prescribing for antibiotics for possible infection secondary to COVID-19. Again, in the very beginning, we weren't sure how to treat this thing. We were throwing the kitchen sink at it just for, and so, you know, that is one way in which that could have happened. Supply and demand increased for hand hygiene products, disinfectant products, PPE, and a lot of those we saw shortages, especially last spring. And that could have led to decreases in compliance with good PPE use, hand hygiene, good disinfectant, cleaning and disinfection, and that could have also contributed. And we focused a lot on healthcare worker safety and not so much maybe the horizontal transmission between patients, trying to prevent that horizontal transmission. We were really focused on healthcare worker safety, as we should be, as we should have been, but potentially that hyper focus sometimes in one specific area around one specific infection, sometimes will lead to other infections suffering from not having that focus. And antimicrobial resistance could have been one of those. And we saw increased healthcare associated infections, and among some of those healthcare associated infections could have been antimicrobial resistant infections. So those are just a few of the hypotheses out there as to how or why we might be seeing such a rise after the COVID pandemic. But I think that this really highlights that it is an issue that IPs need to be focusing on right now in their institutions, need to be understanding better, and working together to find ways to prevent and control resistance.
Heather Saunders, thank you so much for visiting Infection Control today.
Yeah, no, it was my pleasure. Thanks for having me.